Hi guys, it's ekansh here.
And this is Aditya.
We're back with our next video. Sorry for the hiatus. We've been really busy with work and on calls recently. We'd also like to take this opportunity to thank the people who've given us feedback, put some posts on. We've taken the feedback that we've got and we're going to try and incorporate it to make it better and more informative for all of you. Today's topic is actually one which is suggested by one of our subscribers. We're going to be talking about what kind of hands-on surgical training one can expect and what are the factors and what are the things that essentially influence the kind of hands-on training you can get or you can expect to get.
Yeah, and that's why we're going to start about. So we'll start from the beginning from an SHO just to touch up upon it just a bit. But because we've spoken extensively about the SHO jobs in our previous videos, but there's not a lot of elective exposure when you're an SHO, and even when you're a CT, you're expected to do 11 extra capsular hip fracture fixations to move ahead to your registrar grade jobs as well, and that is essentially the only surgical requirement that you need.
So essentially, you're saying is to move from CT2 or CT1 to a SHO level, all you need is essentially 11 extra capsular hip fracture fixations. That is generally DHS or could be an amnial. But is that moving from CT to SHO or SHO to registrar? I think it is more. It is the requirement that you need when you're applying for a ST3 number.
Yes, so it's important. So it's important for you to progress from an SHO level or a CT1, CT2 level to a registrar level grade job, and that's the only, apart from other requirements in terms of only the surgical requirement, that is it. That's all that you need.
Yeah. So as you can expect, based on this requirement, your surgical exposure, hands-on training as an SHO, which is either generally a CT1 or CT2, is fairly limited to trauma. There can be very sporadic and generally very little elective exposure, which is generally attained by being proactive and trying to do that in your free sessions, which is generally not very easy to do. Now, coming to the actual hands-on training on a registrar job, we'd first like to tell you that there are two ways that you can be a registrar. One is when you're on a regular trainee program, which is a Deanery supported trainee program from ST3 to ST8. Obviously, I'd also like to add at this point that what we're talking is generally geared towards orthopedics because that's what we've seen, we've experienced, and we'll be talking about. However, the essence of the factors that determine this have a wider application, and they probably apply equally or in a similar way to other subspecialties as well.
I would say they'll probably be similar in other subspecialties where you do a CT1, CT2 and then you move on to a registrar job. But today we're going to focus on the registrar and the middle grade jobs, which can be either as a trainee or as a non-trainee middle grade or a specialty doctor, or so these terms are fairly being phased out, and the term SHO has been phased out in most places. It's mostly in F1, F2 or in CT2, CT1, CT2 or an ST3, ST4 level job. So we're going to talk about the ST grade jobs today.
Yeah, and there's two ways you can be on it. One being on the regular teaching program and the other is a middle grade specialty registrar. So
like we've talked about it, it's similar to one is being in the actual training pathway on your way to becoming an orthopedic consultant in this country. Through getting through interviews and giving and then being selected for training similar to an MS orthopedic program in India, or what you can recall it, or something similar, or being as an employee of the doctor working at the same level, however not in that particular training program. So this experience does not count towards per se as a training to become a consultant.
We'll start with talking more first with what you can expect as a Deanery trainee when you're in a proper program, which starts from the ST3, goes up till the ST8, as in 3, 4, 5, 6, 7, 8, so about 6 years on. One is generally expected to clear their FRCS by when they're about ST6 to 8. which takes about a year and a half. And the completion of the FRCS is a primary requirement to attain your CCT, which is the completion of the clinical training. And only then can one proceed on to become a consultant.
Yeah. So in these jobs, I think you'll be working on a one-to-one or in a team basis along with the consultant, where you're a trainee and the consultant will be your trainer for that period of time, designated by the deanery, which is overlooking your trainee in that particular region of where you are in the UK. And the thing that will guide your experience is mostly, obviously, the one what your attitude is, what your work ethic is, how you're working, and obviously the other thing would be the consultant that you're working with and your team that you're working with. So it's obviously a two-way street, as always, with respect to any other trainee.
Absolutely. And as we've already spoken in our videos before, that they're usually in 6 monthly jobs where you work across different hospitals within a region, and you rotate to different subspecialties like spines, hands, trauma, arthroplasty jobs, and they generally try and ensure that you get a reasonable amount of exposure in each subspecialty, so that by the time you're finishing your training, you're a well-rounded surgeon. Also, because they have defined indicative numbers of each kind of surgeries that they need to have been involved with or been a part of or have performed to actually attain their CCT.
Yeah, so how it works is like you mentioned, you'll be working in different subspecialties, and each subspecialty will be a 6-month rotation, and this will change every 6 months. What to expect in those jobs is similar to any other job, to be honest. While in the middle grade, with respect to, you'll be doing clinics, you'll be doing theaters, but focusing just on the theater part. In this process, it's expected that for a trainee who's an ST and associated with the trainee, the consultant is expected to train the trainee in those surgical procedures which the consultant is proficient in, which the consultant is regularly doing. So obviously the consultant will take the trainee through those surgeries, teach them initially in the step-by-step, and then eventually as the trainee becomes more confident and grows, he would be expected to do all those surgeries supervised with the consultant scrubbed in, but with the trainee as the lead surgeon performing those surgeries and obviously learning along the way.
Absolutely. So I think broadly we can kind of highlight it as three things that kind of determine the kind of training you get. One being the trainee's skill level, comfort, their knowledge, their attitude and rapport. Second, the trainer's workload, their subspecialty, the volume and the quality of work they're doing. And thirdly is how many trainees that you're around with based on how much work you'll get. Because you have certain indicative numbers, by the end of the training, there is a certain obligation for the trainee to ensure that he gets a certain number done in every job, and the trainer also ensures that this number is met. This is generally done through a meeting at the start of a job, where both the parties sit down and have a meeting and put forward their expectations of what to expect in the job. And towards the end of that job, there's another meeting where they get back together and ascertain how many of the goals were met. If certain goals were not met, what was the cause? They reflect back upon it. And this is also checked with regular meetings with the ARCP meetings, which is done by the Deanery to ensure that the standard of the training is maintained throughout.
So there's a lot of communication involved, obviously, in this process. There will be your expectations, your consultant's expectations, to meet both of them, and obviously your responsibilities and your consultant's responsibilities to train you, along with the input from the Deanery. So what this guarantees is that there's a certain level of proficiency that as a trainee you must reach before you can move on to your next training pathway. So this is a minimum requirement that has to be met, which has been laid out by an external body which regulates the entire training program. And as you mentioned, by the end of the meeting, you can you can reflect upon what happened and how things could have gone differently, or whether it was a great experience, and you can obviously reflect back on that and what you learned at the end of your rotation. So this is the key aspect of it being a trainee, is that there are objective targets that have been laid out by the Deanery with regards to your syllabus, with regards to the number of surgeries you have to perform, which will guide your progression into the next job.
And these numbers are standard and the same throughout for all the trainees across the country.
Yeah, so that standardizes things for the entire nation. Essentially,
I think that is why the training in the UK is as coveted as it is, because of the objectively defined criterias. The kind of training and the quality of training that you get by the end of it is generally fairly high.
Well, yes, and also like I mentioned, obviously it's just not the most important aspect in my opinion is that the quality, whatever it is, it's standardized throughout the nation. So whether you're a dean, whether you're a trainee in the northwest or you're a trainee somewhere in the south, there is a set protocol for each and every trainee. And compare that to somewhere back in India, whether you've done your MS from a private institute or a government institute, that plays a major role in what kind of training you've got and your surgical hands-on experience. And obviously in between whether you're in the north or in the south, and every government hospital has a different workload, and there's no standardized external set number in terms of how many surgeries you do in your MS. So there's a huge variability, and that's one of the reasons why a training program of India, which is MS Orthopedics, is not an internationally recognized training pathway.
Exactly. I think because we might have more numbers, but the lack of quality assurance or the standardization of the training across different institutes in India is missing. If the hospital that one trains in doesn't have a push for a certain subspecialty like say pediatrics, pediatric orthopedics or spines, then your exposure to that particular field remains fairly little. But that doesn't play a part in you getting your degree or not.
Absolutely.
Whereas that is not the case here.
Well, so that's about the training pathway. And the next step that comes on is what if you're not a trainee and you're in a middle grade job working in as a specialty doctor or a registrar in your department. And this is what we're going to talk about next. Just to give you a reminder, as an MCH trainee, when you come or when you join the MCH program, I don't want to use the word trainee again and again to avoid confusion, but if you join the MCH program and you're a registrar through this program, through WWL pathway and the HL pathway, you're working as a middle grade in this country as a specialty registrar, and that's after 1 year of SHO job.
And this is where I think one has to understand the difference, that because you're a middle grade registrar, what happens is when the number of jobs are allocated, the primary allocation goes to the Deanery trainees, and the middle grade jobs are then advertised based on the requirements of the individual hospital or the trust, based on what jobs are available. It is not as per what you'd rather have. So essentially it means to you having to choose from what is advertised, and which is kind of what remains after the the sought after jobs are taken up by the Deanery trainees.
And as soon as you join a job, what our recommendation is, highly recommended, as that you keep a PDP meeting with your consultant or a personal development program in which you sit down with your consultant, similar to the trainees do, and you set out and you lay down your expectations of what you want to learn in the next 6 months from that consultant. And similarly, the consultant is going to feed back to you what they are in a position to provide in terms of training, in terms of educational experience, in terms of hands-on experience, so that it's a mutual decision that you can take forward. And a similar meeting you can hold at the end of your placement, and reflect upon how your placement went, what you learned, and reflect upon what opportunities that you got. And obviously, this is actually, and you can use this in your appraisal, saying because this is actually a record of what you learned in the last 6 months.
So yeah, just to summarize, so we recommend that, and that this applies to us and probably to everyone who's working as a middle grade registrar as well, is to look at your job plan, ensure that you know what your job plan entails, meaning how many theatre sessions, how many clinic sessions, how many on-calls, you get an idea of who you'd be working with, what kind of surgeries, what kind of operating, what kind of clinic work does that team or the consultant do, whether you're happy with it or not, or whether it satisfies the training that you're looking for or not. Secondly, as soon as you start, or even before you start, try and arrange a meeting with the team or the consultant so that the trainee and the trainer expectations are put forward, they are documented and recorded, and goals can be set for that particular job. Towards the end of that particular job, that 6 monthly job, you can then go back, have another meeting, and try and compare to where you started, where you've come, what you've achieved, what you could not achieve, why that could not be done, and what could be done differently. All these things, when documented and done in a proper way, can be used as a part of your appraisal process, and they all work towards your growth. Now, I think we'll talk about the kind of hands-on training that you can get in a job and what are the factors that play a role towards it.
So a job as a middle grade, as a registrar working for a consultant, essentially consists of mimicking your consultant's rota as to what it is. And that generally consists of 3 to 4 clinic sessions and 3 to 4 theatre sessions, which may be trauma, an elective, or a mix of both, depending on where you work and how busy the hospital is.
Just to clear, sessions mean half days here. So you generally technically have about 10 sessions a week. So that's about 5 working days, 2 sessions a day. That's what we mean when we say sessions.
Yeah, and like you mentioned before, so the key aspect in this job is that you have to be wary about and careful about is that there are no indicative numbers here. There's no external regulatory body that is guiding your training in a particular direction, as it is with the Deanery trainees. So where your training goes essentially is up to you and your consultant.
So it comes down to a few factors. The first factor is you yourself, as in the trainee. The trainee's attitude, the skill level, the knowledge level, the kind of rapport that you're able to establish with the team or the consultants that you're working with, and your general personality, they all play a role. The second being the kind of work that your trainer is doing, the quality, the volume, the number of theatre lists, and again, some people are inherently good teachers, some people need a little more work. So these are small factors which play a big part eventually in the kind of experience that you have in the training that you receive while being on that particular job.
And of course, as with any other job, it takes time to build a rapport and a relationship. It takes time to get used to the system. And of course, the most important and key aspect is it takes time to build a bit of trust between yourself and your consultant as to what your consultant is happy to let you do on your own and what he believes you need with more supervision with. So these are factors that, it's just how things are.
And obviously, as you work with more people, as you become more familiar with the system, with the different protocols, obviously, the kind of rapport that you're able to establish improves. Having done things like the MRCS, the ATLS, the CRISP programs, these all factor in making you becoming a better doctor, better clinician. They all work towards you being more professional towards your work, understanding what are the key aspects and ensuring that you do them regularly in a disciplined way. And I think a trainer picks up on all these cues. And as with any workplace environment, be it medicine, be it somewhere else, it comes down to interpersonal skills as well. Mm-hmm. And everything put together then determines the kind of hands-on training you get. However, as Aditya did say, because of the lack of any defined objective clinical numbers, the experience that one has can sometimes vary hugely from being very good to being not so good.
Well, just as a comparison, like you mentioned, again, the focus comes on the regulatory body. Since there's no external regulation, there are no indicative numbers for you as compared to a trainee that has some indicative numbers. What this essentially means is that even the trainers are ethically and administratively obligated to train and teach, and ensure that the trainee, which is the Deanery trainees, numbers are met. However, there is no such administrative obligation on them to ensure that your training requirements are fulfilled, because there are no goals. Essentially, the goals are what you've decided, what your trainer has decided.
And that's why the meeting is important, so that you set the goals.
Exactly. And a lot of the times, what happens is you're going into a job, and this is your first job in the UK. You don't know what to expect, and this meeting will not always be offered to you. So make sure that you ask for this meeting, and you ask to have a meeting to set up a job plan or set up some expectations regarding your posting for the next 6 months.
So to summarize, as an MCH candidate, you would be working at the level of a middle grade registrar.
As a non-Deanery trainee.
As a non-Deanery trainee, obviously. We would suggest that the things that you want to do is you want to have a very good look with your job at your job plan. If needed, discuss it with your employer at the time of the interview or before joining. If there are any clarifications you want, seek them at the start. Ask for a meeting if it is not offered to set goals. Ask for a meeting at the end of the job to find out and determine what you achieved, what you could have done better, and ensure that you work hard and you follow the guidelines, the protocols, and do the right stuff. There is no substitute to hard work and professionalism, just like in any other field.
And similarly, so you have, and there's always a careful, there's always an interplay between yourself and obviously other registrars that are working in the same department, because you will be working alongside with the Deanery trainees as well, and you are a registrar with your own training requirements at the same time. So it's important. That's why again it comes down to that meeting, so that the gray areas and the fluctuations can be avoided. Otherwise, they will always exist in some form or the other in every hospital.
Okay, I think we'll call it enough for this video. I hope we managed to shed some light on what are the things that can possibly influence the kind of experience you have on your training. If there are any questions, or if there's anything that you think we would have missed, again, please feel free to reach out to us or send us an email. Our email addresses are down there. And yeah, any feedback is always welcome. Thank you guys and have fun.